Hello everyone, this is Dan Thibodeau, Physician Assistant and Associate Professor at Eastern Virginia Medical School in Norfolk, Virginia, here at CARPS 2018. Here to talk about cardiovascular disease and specifically the coronary artery disease global approach to overall evaluation and risk reduction. So a couple of talking points and take-home things that we want to be aware of is, first of all, understanding the patient's overall risk for heart disease, namely coronary artery disease, and understanding where we need to look at to evaluate the patient appropriately. And what I'm talking about is the right testing. There are multiple different tests, whether the patient can exercise or whether the patient can't, and we use a step-by-step approach to find out what's the best treatment for that patient as far as evaluating them test-wise. So we have multiple different tests that we need to use, and sometimes it gets a little confusing on what is the proper test to use for our patients. In short, if you don't know, certainly call a cardiovascular office and ask, or work together as a team to get the right approach for assessing a patient for possible coronary artery disease. And then lastly, when we talk about the global approach to coronary artery disease, it's not just about testing, it's also about therapy. So we have to work with our patients, and we used to have guideline-directed therapy that are helpful in understanding what types of medicines the patients need to be on, and more importantly, all the other therapies and education we need to give patients in order to reduce their overall risk. Thanks very much.